Om Sri Sai Ram. I offer my most humble, loving, and reverential pranams at the divine lotus feet of our Lord and Master, Bhagavan Sri Sathya Sai Baba. I am Dr. V. Mohan, member of the Central Trust and a doctor by profession. I am a diabetes specialist. At the outset, I would like to offer my loving Sai Rams to all my Sai brothers and sisters. We are facing a kind of emergency situation which perhaps many of us have not faced in our lifetime. There have been several disasters which have occurred in the last few years, and in every one of those disasters, we have prided ourselves as Sai devotees and as Sevadals and as members of the organization and trust that the Sai or the Sri Sathya Sai organization will be always the first to arrive at the scene of the disaster and the last to leave. However, my dear brothers and sisters, COVID-19 emergency is very different from all the other disasters that we have handled so far. In fact, this is one emergency where the Sri Sathya Sai organization of the trust cannot do the same type of seva that we are used to doing in the past. By this I mean that we would be the first to arrive at people's homes. If they've lost their homes, we provide them food, shelter, we physically help them. Now, this is something which we cannot do, because in this particular disaster, in this particular epidemic that we are facing, that will be the worst thing that we can do, because either we will infect ourselves or we will infect others. So the most important thing that we can do at this particular time is to curtail the infection, the spread of the infection. And the greatest seva that you can do is to prevent yourself or your family members or your dear ones from getting infected, and at the same time see that we don't infect others. What should we do for this? I know there have been a lot of write-ups in the media and so on, but still it is worth emphasizing certain facts. There are three things that we should be doing. The first and the most important is what is called as social distancing. For this, we should work from home wherever possible, because the moment we travel, we're increasing the chances of either infecting ourselves or infecting others. So if it is possible to avoid public transport, gatherings of any type, this is the time when we should do that. If you have an opportunity to work from home, then there is nothing like it. If you do have to go to work, then maintain a safe distance of at least 2 to 3 meters, that is at least 5 to 6 feet or more, between one person and another. We all know that this COVID-19 infection spreads by droplet infection. That means by coughing, sneezing, etc. Through the droplets, the virus is transmitted to another person. So even at home, try to keep a distance of at least 3 feet, because if one person is affected and they may not know about it, because 80% of cases are asymptomatic, you can spread it to others. Secondly, frequent washing of hands. We may think that this is extremely simple, but actually this is one of the most important precautions to prevent the COVID-19 infection from spreading. You can use simple soap and water. It is not necessary to go for some fancy, costly, alcohol-based sanitizer. We have to wash every part of our hand. That is on both surfaces, the palmar surface as well as the outer surface, the back portion of our hand. Also in between all the fingers, the thumb, all the fingers, and then including the tip of the fingers and up to the wrist. If we are able to do this, we will need at least 20 seconds to be able to cover every part of the hand. If we do that, then we can prevent this infection from spreading either to others or to ourselves. The question of masks is the third point that I want to talk about. Who should wear a mask? We are tempted for everybody to wear a mask thinking that we will get infected. This is simply not practical in a country like India, where there are 1.3 billion people. And if we start wearing a mask every day, we'll need more than 1.3 billion masks on a daily basis. You calculate this for the next 1 or 2 months, and it will tell you that it's almost impossible to get enough masks for our country. And then what will happen is that when people really need masks, there'll be no masks available. For example, doctors will not have a mask, or the healthcare workers or an infected person will not have a mask, and then it will spread more rapidly. So don't rush to wearing a mask. Who should wear a mask? The person who should wear a mask is anybody who has any symptoms. For example, if you're having a cough, fever, sore throat, sneezing, or anything of this type, you should wear a mask, because you will not then infect somebody else. If you know somebody else who has these symptoms, then that person should wear it, and preferably all those who come in contact with that person can also wear it. So to repeat again, everybody need not routinely wear a mask. Our All India President, Sri Nimish Pandya, will be soon sending out simple guidelines. We just had a meeting of the National Council where certain simple guidelines have been prepared. It may be in pictorial form, and this will be sent to you quite soon. Finally, the message I would like to leave you with is, don't panic. The more you watch television, the more you listen to WhatsApp messages, half of which are fake, we tend to get worried. We tend to panic. If we panic and we tend to get afraid, it means one thing: we do not have enough faith. We do not have faith in Swami. If you look at the facts, even in China, where it all started, and more than 80,000 people got infected, will you believe me if I tell you that this represents just 0.005% of China's population of people who got infected? Of this, only about 1% died. So you can do the maths and see how unlikely it is that you will either get the infection, or if you get it, that it will turn serious. So what do we have to do? This is the time when we have to remember Swami constantly. Let's pray to our beloved Bhagavan. Let us intensify a personal sadhana and prayer to Swami. Let us chant Sai Gayatri several times a day. Let us read the Sai literature, which we have not had time to read because we are leading busy lives, especially the Vahini series. The All India President has already referred to this in one of his circulars. This is the time for us to be reading the Vahini series and other Sai literature. Think constantly to Swami and pray hard. If we all pray together as a community, I'm sure that Swami will take care of us. He will protect us. Swami has repeatedly said, why fear when I am here? We know that he is still here. His physical body may not be present, but we all feel his omnipresence and his omniscience and his omnipotence every single day as his devotees, and therefore Swami will definitely protect us. He will definitely take care of all of us, and therefore my prayers and my very best wishes to all of you. Be safe, take care, but don't panic. This too shall pass. Jai Sai Ram.